In most developed countries, there is a rapidly aging population. Now, this is good because it means we're going to be living longer, but the problem is that the healthcare infrastructure can't keep up, and soon we're not going to be able to provide adequate health care for our adult citizens. So we asked the question, can social robotics, can companion robots help solve this global healthcare problem? Can a robot like Lumo help provide health care for the elderly? So to help us answer this question, and as part of EmTech Asia Week, over last weekend we had the first ever MIT Hacking Medicine Robotics event here in Singapore. We had 5 robots like Lumo, we had 12 teams, and we spent 48 hours trying to solve that problem. And my panel, who I'm going to introduce in just a moment, will tell you a little bit more about this event and the conclusions that we came to. But first, let me introduce you to our guest of honor, Lumo. Lumo?
Hello, EmTech. My name is Lumo, also known as a Segway robot. I was the robotic platform for MIT Hacking Medicine last weekend. Very excited to be in Singapore.
Thank you, Lumo. And now I'd like to introduce our panel, Charlene Liu. She's the adjunct consultant at Access Health. Sarah Zhang, who's the Senior Director of Robotic Business Operation at Ninebot. And after the hackathon, we had a panel of judges who were experts in robotics, healthcare, business, and government. And out of the 12 teams, we selected 3 winners. And so representing each of the winning teams today, we have one person. First, for the winning team, Kok Young Yik, who is with the team Botler. The second place winner, a team called Dory, and representing that team is Emily Schlitten. And representing the third place winning team, a team called Now, we have Sophia Chu. The panelists could please be seated. So my first question is for you, Charlene. Could you tell us a little bit about MIT Hacking Medicine Robotics, and how is it different from a regular hackathon?
Sure. Before I get started, just want to take this opportunity to thank our sponsors and partners for the weekend, founding sponsor SGInnovate and our robotic platform partner at Segway Robotics. So before I get started with this question, who here has attended a hackathon before? Either as a, okay, so some of you. So as you may know, hackathons is portmanteau of a hack, which is, a clever way to try to make something better, and a marathon. So this, a long endurance event, so as Howard mentioned, is 48 hours. At MIT Hacking Medicine, the process is actually fairly similar to most other hackathons or codathons. So 5-step process. Yep. Go ahead. A 5-step process, and first we invite participants to pitch the solution, pitch the problems they're passionate about solving that weekend. Second, we invite everyone to mingle and form organic teams based on what they really want to work on. This might be familiar to you when, this might be what the word hackathon brings to mind. We get people to hack, get people to work deeply on the problem. And then, fourth, we invite mentors to come in and really speak to our hackathon participants, bring them to that next level. And finally, we present. So if you've been to hackathon, codathon, doesn't sound like something, may not sound like anything particularly different, but really there are 3 ways that we think a healthcare hackathon, and especially one that MIT Medicine, Hacking Medicine holds, how they're different. And first, it's you don't have to be a coder. You don't have to be an engineer. In a healthcare hackathon, we emphasize that over 50% of participants really come from other backgrounds, designers, business people, and especially healthcare professionals who understand the source of the problem and where people can be of most impact. Secondly, we focus not on solutions, but really we try to emphasize what problem our team's trying to solve. Do you really understand your users' needs? Have you asked the right question as to who is benefiting versus who is buying versus who has to implement this new process that you're trying to create? And finally, to really emphasize that we bring in mentors who typically aren't themselves necessarily technical. We bring in healthcare people, we bring in eldercare experts. And this really just gets teams to understand the problem deeper and enables them to make impactful solutions. So at the end of the day, our hackathons, healthcare hackathons, we don't want healthcare widgets. We really want to enable over the weekend sustainable healthcare businesses. Howard?
Thank you. Very good. Sarah, maybe you can tell us a little bit about Lumo, the Segway robot, and also let us know if there's anything that you learned, new capabilities that your robot has that you didn't think it had as a result of this hackathon.
Sure. So first of all, this is Lumo. It's also known as a Segway robot. And can we have the slides? Sure. So I think it's a very exciting time right now because the outbreak of upcoming robotics outbreak is driven by two very interesting factors. One is that a robot is expected to be the new computing platform that conveys a brand new form of interactions. As you can see, actually just now, it's a lot of challenges as well. A lot of those interactions is much more natural, like voice interactions, vision-related interactions. But also, there are a lot of challenges as well. For example, how do we actually design a multi-sensor integration type of interaction that makes sense? A lot of you probably wondered, why did Lumo turn around just now? Because we would think, because we're also learning. So we thought, okay, it would be cool if we call the name of the robot and it will turn to you. But at the same time, this interaction probably doesn't fit all of the use cases. So I think, for this, it's very, very interesting. On one hand is to making the underlying technology very stable. On the other hand is with the emergence of this new form factor, how do you design new interactions with huge potential? It's quite similar with the last phase of development that we are all familiar with in the personal computer when it moved to mobile devices. Then from this type of typing experience to such a handheld experiences, a lot of application needs to be redesigned. But at the same time, like the speakers yesterday mentioned, AI as well as robotics present a lot of very interesting opportunities to have new interactions. And part of that is very, very relevant in the past weekend, because for elderly compared to younger generation, actually they are more used to more natural type of interactions. A lot of people ask, why can you just put certain things on a mobile phone? Simple, because for elderly, they cannot see the they cannot see the very little keyboards on the phone that we younger generation is used to. And the other thing is this increasingly powerful capabilities to acquire, process, and compute data, and especially data is in a very wide range of forms. So we built this platform to be, in a sense, a very powerful computer that can move around to collect many more new different type of data. And that's very applicable to the elderly care scenario as well. We can combine the data into the health of the elderly or patients, such as the drug compliance data that the physicians really want to have, together with the prescription data, for example. This is just one example how this new device that can collect a much wider range of data and compute, and that can be built into very useful applications in a wide range of verticals, including elderly care. So what is Lumo? What is the Segway robot? A lot of people probably is more familiar with the scooter mode, which we kept in this robot. But now it is a smart machine that transforms between a robot and an autonomous moving robot and a self-balancing vehicle. And our idea is to build this platform so that a lot of people can bring alive your dream robots by simply building applications and adding accessories. So what's very special about Lumo, besides the ability to move, is that it is extendable both through a software development kit on the software side, as well as it's extendable on its back through an extension bay. Then you can add actually additional accessories to adapt it. So we want to democratize this experience of building robotic apps to many, many people. And you don't need to reinvent the wheels that you don't want to reinvent, but we welcome you to invent whatever you want to do so. So that's kind of the idea. So how we measure whether we are doing so successfully or not, we definitely measure ourselves on whether we are accelerating the speed for our developers to build useful applications. So that's how we measure it. So Lumo, this is the previous edition. It was first introduced as a concept prototype back into the keynote of 2016 CES. And then it received a lot of very good remarks from the tech media community, as well as a lot of technologists. So we went on and formed Segway Robotics under Ninebot to focus on personal robotics. And we spent the past year to really productize this. So now, and we shipped out our very first alpha developer edition last year in November. And this is the platform. So you can see we spent a lot of time it's a very interesting suite of different type of sensors. It's powered by an Intel processor. And besides the self-balancing base, which is a great base for robots because it's very agile, it gives a lot of flexibility on what kind of structure you can attach to it. It also incorporates the RealSense camera, which gives you both the color and depth images, which can power a lot of computer vision as well as navigation-related use cases. And it also has ultrasonic sensors. It has IMUs. It has 4+1 microphone arrays that can power voice interaction. So a lot of the researches we have done in AI was built. It's very domain specific. It used to be the speech person does speech and the computer vision person does the vision. Now with this platform, we can finally try to really dive deep into how to use a multi-sensor type of platform to make a lot of the computing much more powerful and get good data. And I want to also highlight again, because there is actually a hardware extension bay in the back as well. A lot of people have know about this, saying hardware is hard because it takes a long time to assemble something. All the sensors are not interfering with each other, and it's mass producible, etc., etc. So we made this platform, and okay. And and in the back we provide the 2.0 USB 2.0 protocol where you can actually add additional accessories through the back of the robot, and it provides the power as well. And for the software side, so we provide 6 very interesting skills through our software development kit, where developers can combine them. They include vision, speech, navigation, connectivity with other type of devices. And we also understand interaction is very important for a robot, so that's also a part of the package that we provide and the extension bay. So what did our amazing developers here, as well as our other developers, have got over the weekend then? So it's basically Lumo's developer edition is on 3 layers. They got the hardware, which is very stable and extendable. There's an operating system, and on top of that, they got the SDK, they got the extension bay. And from that, they can start combining those skills to make very cool things, which later on our teams will share what they have identified. So we have received a lot of interest. So it seems to us that a lot of people really need such kind of platform. And through those interests, we also see where do the crowd think about where the future is for robotic applications. They concentrate in those areas, and definitely about 15% of them are from elderly care. So our partner BMW was able to build this very first third-party developer app with 23 days, and they mentioned that, and it was deployed in Las Vegas, which is serving as a robot valet for autonomous driving cars. So this validated our thesis that it is much faster to build robotics app now. So. And over the past weekend, we did our very first hackathon here. And through those hackathon, and that was our first hackathon in elderly care, we have learned a number of things over the weekend. One is that, as I mentioned, robotic interaction model actually have pretty natural advantage in the elderly care use cases because NLP, CV, and also mobility, which hugely complement the fact that elderly might be harder for elderly to move around. Not necessarily in the traditional Segway sense, they ride on it, but fetching things to them and helping them around the house. So we see there are many ways for Lumo to actually improve the efficiency and quality care for elderly care in many ways. Of course, many of them should be measured with outcome, but a number of examples. One is that it can provide leverage to the caregivers with its locomotion skills. 10% of the time of all the caregivers spent on pushing the wheelchairs for people, and we can, and one of our team try to solve that problem. And also, a lot of the robots can also try to prevent and early detect chronic diseases, such as dementia, by building into some of scientific methods into the app. Another team was interested in bringing the hospital level rehab experience into homes by the telepresence and the monitoring skills. So also, as I mentioned, it's a good way to combine the compliance data with the prescriptions data. These are just some early examples. The idea to launch a developer program is to invite many smart people who know about problems deep into the vertical to work with us. And the best way to predict future is to invent it, and those are the inventors, and I will pass down to them then.
Okay, Sarah, thank you very much. Now let me ask the three winning teams. Could you tell us the problem you were trying to solve and what the solution was that you came up with? Please start.
Yeah, thank you. Hi everyone. So in short, the problem that we want to solve is autonomous mobility in healthcare. So imagine you are in a nursing home. You have about 50 elderly which are wheelchair bound, and you only have like 4 caregivers. And in a single day, you have like breakfast, lunch, tea break, recreation time, bathroom, and these caregivers have to push them around, and this really took a lot of their stamina. And now you imagine Lumo with really happily come to the wheelchair and with a really cute expression, dock to the wheelchair and bring the elderly to the kitchen and have a warm lunch there. So and this will give the caregiver more quality time with the elderly. And so our solution is called Botler. So it is generally a universal wheelchair docking system where you can adapt it to any wheelchair, and also we have another magnetic tail for Lumo where it literally looks like a tail because it's rounded, and it will enable Lumo to automatically dock to the wheelchair and translate the pulling force and pull the wheelchair to whichever location that he wishes to go. And once it is docked, it forms a 3 degree of freedom arm that actually translates the force and also adapt to the unique drive kinematics of Lumo. As you can see, this is self-balancing Segway robots. Yeah, so basically that's the solution from us.
Emily?
Hi. Oh, you need this?
The problem that my team aimed to address was the societal cost of the late detection of dementia, because the longer it takes for you to detect dementia, the longer the disease goes untreated and without proper intervention. So our solution to this problem was to create Dory, an interface on top of Lumo that would work in. I'm so sorry. I won't say it.
Here's the name.
Yeah.
That would work on top of this robot in eldercare facilities that would interact with the seniors. And through this interaction, it would be enabled to assess the cognitive health of the seniors they're interacting with. So through the conversations that they're having and through the questions they're asking, it would be able to detect the seniors' cognitive health. And then to take it a step further, it would store this data in a cloud-based system that would be accessible by the patient's doctors and the patient's families, so they would be able to have this information. And then another step after that is eventually we're hoping it would be able to assess cognitive decline. So immediately once the patient starts to exhibit these symptoms, we would be able to know right away. And this means that the patient would be able to receive the correct treatment as soon as possible.
Okay, thank you. Sophia?
My team focused on using technology to better manage chronic disease, which is one of the major health issues that will face elderly. And we focus basically on better management of hypertension, the number one common disease that afflicts 1 in 4 Singaporeans age 40 and above. So we imagine that Lumo is our nurse on wheels, or NOW, N-O-W, that will actually be able to attend to the needs of the elderly living alone at home right now, at that very moment. It is able to recognize the elderly patient. It will be able to interact, ask if the patient is well as to monitor the patient's blood pressure, which we use. And in the event that it detects that there is a problem, we'll be able to then interface with a healthcare professional in a remote site on his mobile device, and using the visual sensors of Lumo, the healthcare physician can then actually make a virtual diagnosis. In this way, there could be 2 pathways. One, he could tweak the medication, and Lumo can continue to monitor the patient just like a nurse. Or if there is an emergency, like there's an impending stroke, an emergency service, emergency response team can be dispatched immediately. We foresee that if we have such a system with a 24-hour nurse by your side, we will improve healthcare outcomes. It will reduce the healthcare costs, improve productivity, and also address the very pressing issue of manpower shortage.
Sophia, let me ask you a follow-up question. You're a physician. The purpose of the MIT Hacking Medicine was in each team to have a diverse group, to have physicians or healthcare providers, developers, programmers, as well as business people. Is this the first time you've been in a hackathon? And what was it like participating in a multidisciplinary group like that?
Yes, this is the first time I've been to a hackathon. It's a really exhilarating experience. We had a very interesting and diverse team. I was the physician who came with a problem. We had developers who are essential to do all the connects. I think in any feedback loop, you always have an afferent limb where you have all the sensors, all the wearable devices there, but it perhaps doesn't connect to a professional who is able to integrate that kind of information. And then you have an effector arm where you have an emergency response team. And of course, out of those many limbs, many business ideas can also be forged. We had a banker actually on our team. So I think it was really exciting to see how different people from very diverse backgrounds bring their talents to the table and solve the problem.
Very good, thank you. Now we have a couple minutes for questions. Who would like to be first? I think we have runners with mics. While you're getting ready, let me ask Sarah, as an expert in robotics, what do you see as the future of social robotics? And do you see applications other than healthcare in the future?
So I think social robotics can play a very important role in our society in the future. We we think a lot of that will be related to human-robot collaborations, instead of a traditional view that robot is designed to replace certain type of tasks. And a lot of those, in order to achieve that human-robot collaboration and this interaction piece, which is by nature very similar to the social piece of it, is really in the core of it. And besides the elderly care, we also see, we gauge those interests from our developers because we talk to them. Why are you getting a robot? What problem do you see? Why do you think this can solve? And a lot of them are in the space of different type of services. For example, one of our partners in retail, and they said a lot of loss in retail, the revenue loss in retail is people couldn't find where it is. And especially for IKEA or B&Q, you just can't find where it is, and people got frustrated and they left. If you can load your shopping list, and it's hard to find people to drag you around. And so if you load your shopping list to the robot, and Lumo can just optimize the route, and it won't be able to pick it for you, but it will say, okay, it's at this shelf, then you can get in and get out really fast, and much better shopping experience, huge revenue improvement for retail as well. That's one example. Otherwise, a lot of AI researchers are looking for a good platform to test out algorithms, as well as in entertainment, like it can be a new gaming platform as well. Just a few examples.
Thank you. Well, our time is up. I'd like to congratulate the three teams that won and encourage you to continue forward and have some impact and actually get Lumo into the healthcare environment. And thank you for the rest of my panel, and thank you for Lumo. So if we could give Lumo an applause. Okay.